Hello everyone, my name is Madira Tindaswari and today I would like to explain to you briefly about my paper called Nocturia Overview, a survey from general practitioner in Indonesia. So I made it together with my supervisor, Prof. Rina Elianti Raharjo, one of the urologist consultant in Cipta Mangunkusumo Hospital, Jakarta, Indonesia. So as a background, nocturia is described as the need or the number woken up at night to urinate, which is avoid, proceed, and followed by sleep. So if you haven't slept before, we cannot call it nocturia. It is included in lower urinary tract symptoms and it is reported as the most bothersome symptoms because it can cause long-term sleep deprivation and lower someone's quality of life because you lack of sleep. So it is important for us to know how to diagnose and to treat nocturia, especially for general practitioner, because this kind of patients usually come to general practitioner before they come to the specialist. So the aim of this study is to review the management and also the diagnosis tools of nocturia among Indonesian general practitioner. So the study used cross-sectional design. So we collect the data by distributing self-made questionnaires online using Google Forms, and we distribute it in, to the people, to our colleague, and we take it from October to 2021 to March 2022, and we got 252 participants that filled the questionnaire. And from this questionnaire, we can see that most patients that came with nocturia aged between 50 until 65 years old. And also, they usually have the symptoms in less than 2 weeks before they came to the doctors. So different approach were done for this kind of patient. Usually, we can diagnose it with anamnesis and also physical examination, but only some of the general practitioner use the OBSS or IPS as the scoring system, and also not all of them using bladder diary, which is really important for patient with nocturia to diagnose this kind of patient. And for the treatment, usually the general practitioner choose to do education and lifestyle changes first before they move to the medication, such as alpha blocker and desmopressin. And only 65% of the respondents refer the patient to the specialist, such as urologist. And it is really important because nocturia is not included in our competency as the general practitioner. So we need to refer it after we do the initial diagnosis and also treatment first. So as conclusion, the general practitioner in Indonesia face a difficulty in dealing with nocturia, maybe because the lack of knowledge about this patient, because it's not really common as a general practitioner. So it's really better to refer this kind of patient to urologist or to another specialist that are related to this patient after they perform the initial diagnostic examination and standard therapy. Thank you.